it's Judy Farmer, GreatPilatesNow.com, and I'm really excited to introduce to you Dr. Lawrence Morabito. He's an excellent, wonderful chiropractor who's local here in Canton, Michigan, and he's going to teach us some exercises that will help us to kind of get our back and neck in better shape after using these handheld devices all the time.
The newer generation's always coming in with complaints of neck pain through here, tingling in the hands, and a lot of it that me and other colleagues find is it's coming from the cell phone use and the tablets. Computer use has gone way up compared to the past. So one thing we always find is there's a lot of muscle tension in these particular areas here. And then as you go a little deeper with like the x-rays and the exam we take, you find out that their curvature is way off.
Misalignment of the spine?
All the time. And there's simple little fixes that you can do prior to coming in to see us that I feel these little exercises can be beneficial to your clients as well as some future patients, that if you give this a try first, it might free up some of the area, and if not, then you're welcome to come on and see me.
You can hear Dr. Larry really cares about people because he wants to give you some exercises first to see if you can correct the problem, and then if it still bothers you, then you can come and see him.
A lot of things you'll see people doing, whether sitting, waiting for a bus, in their car, text messaging, whatever they're doing, it's always like this, and they're down, and going like this. And it seems goofy, but the best way that you can stop having that anterior head carriage with all the muscle pull is if you text, and you always make fun of people that are older going like this, but if you keep the phone more of an upright ergonomic position where it's at your face, text. You gotta remember your head's about the weight of a bowling ball. So if you think about it, these muscles are constantly holding the bowling ball this way. So muscles in the back are getting real strong, muscles in the front are getting weaker. And as you notice some of your colleagues at work, you might start seeing their head doing this particular thing. It's because there's not enough muscle tension in the front, or the muscles here are firing too much opposed to the back. So the exercise I'm going to show you today is how to stretch those out and see if that corrects things, and if it doesn't, then stop on and see me.
Okay, great. Let's get started.
All right, so the first muscle that is usually affected is called a muscle called the vater scapula. And what that muscle does is it attaches here, goes down to right about in here, and I'm guaranteeing a bunch of you have the little pain right here. And the whole premise of this muscle is to kind of elevate the scapula. So a good way that you can stretch this out is if we're trying to stretch the right side. I'm going to have her tilt her head a little bit like this. She's going to use this hand to just lightly pull, and then she's going to take this hand, put it behind her neck, just to give a little tension, and just pull down like this. And that'll stretch that particular muscle real well. The thing I recommend to most patients is repeat it about 4 or 5 times, hold the actual hold for 3 to 5 seconds, then release, and then do it again for about 5 repetitions, and that'll free that muscle up real nice. Now this one, I'm going to have Judith pull her head to just a straight lateral bend like this, and she's going to take this arm straight on like this and drive, trying to touch her knee on this side. Don't pull too much, and it's just all a nice gradual stretch. Same thing again, 3 to 5 second hold, repeat it 4 to 5 times.
And then I would say add your long breath.
Yeah.
Breathing in and out.
Breathing is key through all this. It allows the muscles to relax and kind of go back to their natural state where you want them to go.
And keeping your chest lifted, not punching down.
Yep, you don't want anything where you're, if you notice you're pulling yourself forward, everything's got to be that proper posture where, you know, kind of like the military.
If you've been having trouble with this posture, you're going to have to constantly remind yourself to get up straight and stay lateral. Your tendency will be to bend forward.
Yep, I agree, totally.
So how many times, how many reps for that one?
Same as the other one. I usually recommend for all my patients anywhere from a 3 to 5 second hold, repeat it 4 to 5 times, and then see how you feel from it.
So you've gone over the levator stretch, and what would you call the second one?
Scalene.
Scalene stretch.
Yep, and the final one that I love to do just myself, just to stretch anything out, is for the upper trap area. And that area we're talking about attaches right here at the base of her skull, goes out in a nice diamond shape like this, comes all the way back down about here. And the best way that you can stretch that is, again, if you grab your head and tip it to whatever side you like, and you're going to take this arm right here, and you're going to try to drive just like that.
So I'm lifting through the chest and pressing that shoulder down gently enough, remembering to breathe in completely and out completely. 3 to 5 seconds?
3 to 5 seconds.
Oh, good. And then how many reps?
Same thing, 3 to 5.
Okay.
If
3 to
it's
5.
more of an intense pain, you can actually hold the stretch a little bit longer and do 2 sets instead of just 1.
Okay. So we had the levator stretch, and
Yep.
then the second one was
Scaling.
the scalene stretch, and the one I
The
just
third
did.
one is the upper trapezius stretch.
Okay, so those 3, if done 3 times a week, will help like heal yourself from this posture of hurting your neck. And then we want to do this ergonomic way of holding the phone. What does ergonomic mean?
There's never supposed to be a time where you're jutting forward, your pelvis is tipped like this.
Mhm.
The proper way that you want to stand is like this, and you always hear everybody say, oh, well, I got my ergonomically correct chair. It's usually because there's a lumbar support to keep you back
Oh,
like
yeah.
this. I got an ergonomically correct shovel, and it's the one that's like this, so you're not bending over like this to do it, you can stand like this. It keeps everything in the proper alignment that you want, so that way you're not causing these problems that you're feeling.
Very good.
So,
Well, thank you so much for joining us
no
today.
problem. I'm
And,
glad I could be here.
You can see me at greatpilatesnow.com, and please like this video and pass it around. Really, I'm sure that Dr. Larry would love for more people to benefit from these exercises. Thank you.